The work that I do at Involve and NIHR has a couple of dimensions to it, I think. First of all, NIHR is a long-standing programme of work that's been funded by the government to promote public involvement in research, all forms of research. And by public involvement, we mean the public taking part in decisions about research strategy, about the methodology of research, right down to disseminating that research to other patients and the public. The second aspect is really about trying to make sure that the NHS is set up and also the system is set up so that it engages patients better, so that they're able to participate in research. They know what research is, they know the evidence to look for, and they know where to go to take part in clinical trials and other forms of research. It's quite a wide canvas, and I think that's what makes it so exciting at this moment, when there is so much public interest in research that's generated by the media and other sources. I wanted to work in healthcare because I wanted to make a difference, like a lot of people. But when I entered the healthcare sector in the early 90s, I think I was strongly motivated by the desire to see patient rights and the patient themselves and their experience put right at the heart of healthcare delivery. And from my own personal experience, that didn't seem to be the case at that point. So I think I entered it with sort of campaigning zeal, and I hope I've lost none of that in terms of what I do today. The way I'd like to see the clinical research sector change in the next 5 years is threefold. The first, I think, is that I want to see the NHS very much wear research on its sleeve rather than tucked inside its inside pocket, as it has been for so many years, and to engage the public about what it does in research. The second thing is I'd like patients themselves to feel they have the evidence and the tools to be able to go to their clinician and their doctor and say, I'd like to know more about this trial and I'd like to be considered for participation in it. And I think the third thing is I'd like to see all funders of research who raise money from the public or are funded by the taxpayer to really put public involvement at the heart of their philosophy for how they fund research in the future. The most difficult thing I've had to deal with at work, wherever I have been, is about fear of change and the fear of what that might mean for an organisation or an individual. And we live in a world where there's constant change. And it's very, very difficult to get people to feel confident about their own part of it and also about how they can control and manage and shape it themselves. Perhaps my proudest achievement, perhaps I should say my proudest achievements, because I'm lucky and I feel I've got a number. I think it begins actually in the 90s and being part of the campaign that changed the way that care costs were assessed and what people were asked to pay for their care. And that was causing concern then as it is now. More recently, I think my achievements would be, first of all, being Chief Executive of the Association of Medical Research Charities and making that umbrella organisation a lot more patient-focused in how it thought about clinical research and the funding of research. And lastly, being appointed as Chair of Involve, I feel as though there's a great deal of rich history that I've inherited, and I'm really looking forward to taking that forward over the coming years.